So I'm going to focus on what my nighttime routine is, and sorry, the bathroom is a bit echoey, but first of all, I don't really have any makeup on other than a little bit around my eyes for mascara, but I have a lot of SPF on, so I'll take that off, and I'm going to take that off using this lovely Centella, and also I'll then use the Cetaphil Gentle Cleanser. So just a little bit of this, and one of the reasons I actually got into dermatology from the very first place was because I wanted to treat patients who had skin cancers. I had seen a patient whenever I was doing my ENT head and neck job, and they had a big skin cancer in the ear, and I was there as part of the head and neck team. In other words, we were doing the repair of it, and it was actually a Mohs surgeon who's a dermatologist removed the skin cancer from the ear, and it was such an intricate, neat kind of surgical procedure. I thought, oh my gosh, I didn't even know dermatologists did that, and I want to learn more about it. And I sat in his clinic and realised actually dermatology was probably the best specialty in the world, and how I needed to move over and become a dermatologist. And so I applied, did my training down at King's College London, which is where the first lot of my training all happened, at the Institute of Dermatology. And now I'm going to wash my face in my lukewarm water, and I am a bit anal and I love a lovely white fluffy face cloth. And then I'm going to pat that dry. I'm going to do my second wash. So I'm going to wash with my Cetaphil Gentle Cleanser. I'm just making sure I'm getting all of the bits of sun cream off. I don't want any of that on overnight. Pat that dry. So I've cleansed my skin entirely, and then I put on my 2 pumps, 1, 2, and then this is what gets patted onto the skin.